difference. Remember, for example, in mental health space now, within the last year, we had so much progress. We have the inaugural mental health conference that was hosted in Nairobi at KICC. So after that conference, there was a task force that was to be commissioned through the president's directive, which was going to take action and find ways of addressing mental health problems. But at the end of the day, with all that progress that had been made, at this point, we have response mechanisms that have been instituted. There are different activities that are being started on, but most of these are not going to see the light of day. And even some of the people who might be having mental health devastation at this point are not given the support that they need. So the question is, how do we move to a point of ensuring people have access to mental health and mental health services, that is, and for the progress that had been made in the previous days, not to go to waste? How do we revamp our activities? So that is the reason as to why we're having on this session today. So just to look at it, because the target audience were people who are mental health champions, people who have an interest in mental health, psychiatrists, students, medical psychologists, students, medical students, anybody who has an interest in mental health. So we look at it from the point of what does mental health encompass first. So it starts from a point of every individual realizing his or her own potential, being able to cope with the normal stresses of life, being able to work productively at a personal level, that is one. And then after working productively at your personal level, the question is, are you able to contribute to your society in a meaningful way? So if you are able to, then it means you could say you're mentally healthy. So that is one of the critical components that we're looking at when it comes to mental health. And at this point, we are looking at it in terms of you as a person, you as an individual interacting with other people in your community. Are you healthy, or are those people with whom you're working living healthy lives? Are they able to perform optimally in their settings? If they're not able to, then what can we do as an individual, as a group of people, as mental health champions to ensure they are in a position to live a healthier life? They're able to thrive in their different spaces of work, and they're contributing meaningfully to their society. So we look at it in terms of what are the factors that have a component in mental health? There is the social factor, the psychological factors, and the biological factors. Most of the biological factors are beyond our control. If I'm from a family that had been suffering mental health issues, then I'm more predisposed to having a mental health problem. I don't have control over it, but at the end of the day, I can find a way to cope with it and get redress for the condition that I'm suffering from. So those are the things that I can do. The psychological mental makeup of an individual. How is your mind made up to function in a particular way? How do you process your emotions? How do you process the circumstances that you faced? And how do you ensure that you're able to perform optimally within the circumstances that are around you? We might not be able to choose the situations where we're existing, but then we can respond to them in a favorable way that will enable us be able to function in the optimum level that we can be. The social factors involves the things that are happening around us, things happening to us, happening within our relations with other people. So if we can be able to influence our social relations with people, we can work on it to ensure that it enables us to thrive, and also our relationship with others to make them be able to thrive in their own space without having to suffer the consequences of the interactions that we have. So those are some of the critical things that we need to look at. Then with coronavirus outbreak that started in 2019 towards the end of December, there have been issues that have been coming up. And when we look at it in terms of the key influencing factors on mental health, we can look at the social factor, the psychological, the biological, even other contributors such as stressful work conditions, if you're going to work. And if you're not going to work, for example, at this point in time, when we're talking about working from home, you're at home, you have other responsibilities at home, you have your family to take care of and all that, then the conditions would not be as conducive as you'd want them to be, meaning you might not be able to perform at your optimum. So that is going to affect you at the end of the day. Some people are going to lose jobs. Those are speculations that have already been there. Maybe some have lost their jobs. We're not sure how it's going to move from there. But how do we ensure their well-being as an individual, whether you lose your job or you retain the job, is going to be optimum? Social exclusion, for example, we're talking about isolation, quarantine stations and all that. Those are things that are contributing to our well-being in terms of our mental wellness or our ability to mental well-being as an individual, the psychological conditions that will make us thrive in where we are. So looking at what ideal mental health state would be: a mentally healthy individual being able to realize your potential, cope with normal stress of life, work productively and fruitfully, and being able to contribute to your community. Then we look at it in terms of what are the advances that have been made. And I initially started by mentioning that as a country, Kenya, we had the inaugural mental health conference in 2019. Then after that, there was a task force that was to be established under the directive of the president. We have civil society organizations that have been in the mental health space that have increased over time. We have so many of them at this time. Then you have mental health care providers. Initially, when the whole action around mental health started, we had average lists only, that was in 2012, 2013, 2014. 2012, we had 74 psychiatrists. Now we have up to around 500 and something mental health service providers. So there's been that improvement. But the question is, if there have been an improvement, are we engaging them to offer the services that are being required of them? If not engaging them, how would we ensure that the value of mental health occurs is being felt in the society? So yesterday I was reading an article written by Harvard Chan, and there's an excerpt by Dr. Edith Kamaru, the head of psychiatry department at Moi Teaching and Referral Hospital. And she said that Africans as a general, we experience the same mental health problems as people from the West. The only difference is in terms of how we take care of our people who are suffering mental health problems, how we respond to these kind of medical conditions, and the way we act on them. So looking at the whole scope, we realize that the mental health treatment gap, we have Africa up to 85% of the mental health conditions are not being diagnosed. They're not receiving the care they need. And that's a wide gap that is there. In the Western countries, we have up to between 35 to 45% people who are not getting access to the care they need. So that's a wide gap. Does it mean that we're not having these problems? No, we do have them. So if we do have them, we need to do something to ensure we are going to respond in a favorable way. We are going to ensure the people who need the services are getting them, and then we improve from there and ensure that the advances that have been made, we are not going back on them, which is very critical. So looking at it in terms of the advances that have been made, what are the key priority areas that have been focused on? We have been having people working on ending stigma and discrimination associated with mental health. So stigma and discrimination has been there. People you find, like, for example, parents who have been having kids who have mental health conditions, in a way, we've had them being hidden in the family setup, or being even not being treated as well as it would be for any other child in that family. So that is, they're discriminated against. They're not going to get access to education and all that. And that is not only because of at a family level, it's even at a societal level where we realize that people relate with the people with mental health conditions in a different way. Let's say, for example, people who've been drunkards for a while, who got addicted, who are suffering from addiction from alcohol use, then we perceive them in a different way, and there's stigma and discrimination because of their condition, their affiliation to alcoholism. So those are things that we need to address. Then mainstreaming of psychological services. We have issues that are now, we have, for example, we are talking about Moi Teaching and Referral Hospital having a head of the psychiatry department. So we're having those services within the hospital setups. Kenya, we have Mathare Teaching and Referral Hospital, that's on Thika Road, Nairobi, where each focuses majorly on mental health conditions. Then another component has been integrating of rights into mental health. When you're dealing with people with mental health problems, you have to realize they have rights as every other human being. How do we ensure that they're being treated in a humane manner, that their physical disease, their condition as a mental health condition, does not make them be less of human beings? And some of the issues that were being talked about when we're talking about rights on into mental health was in how these patients were being treated. You're in a hospital, you are tied with ropes and all that. You're being beaten up. The kind of language that we use when we're referring to people with mental health problems. Those are issues that have been addressed in some way or in some form have been looked into. Then another critical thing has been in terms of promoting access to care. We're talking about creating safe spaces where we could talk about things that are affecting us, people with mental health problems, people who are predisposed, for example, young people who are facing unemployment, and all the social issues that are affecting us. There are virtual platforms that have been coming up. For example, there's one known as Inuka. It's a virtual platform that gives you a chance to interact with people and chat about the issues that you're feeling. It gives you the redress that you need at that particular point in time. increasing access to care providers. That's example in terms of increasing the intake of people doing clinical psychology, voluntary counselors, and those different people who are able to offer the care that's needed. There is the mitigation of the contributing factors to mental illness. So when we talk about the mitigate contributors, we can talk about it in terms of, do we have the social structures that will enable us to be able to interact with others better, to be able to not have the kind of isolation that you feel, anyway, I'm getting lonely at this point in time, and the loneliness is going to make me have a mental health problem. Those are some of the things that are being addressed. Unemployment is a very critical thing among the young people. How are we addressing unemployment? And all those issues that might financial independence and all that, educating, different platforms coming on board to address all the contributing factors. So those are the mitigating factors that have been put in place. And if you guys can bear me witness, there's been an increase in terms of the financial service providers. That is in terms of the loans that are giving people social development initiatives. And that is one of the things that I would mention. Most of us know about social entrepreneurship. Mohammed Yunus is the founder of kind of the head Yunus Social Development Group, and it has been gaining traction because it's giving people an option on how to make money and address the social problems that are affecting them. Mitigating these social problems are going to ensure they have a mental, they get mentally well, while not going to have suffer from the other contributing factors like being broke, being in an abusive relationship and all that. So these are things that are being addressed. So those are the focus areas that have been there over time when you're dealing with mental health. And these are kind of linked to the social determinants of mental health. So on this slide that I believe you guys are seeing with me, or maybe if you're not, you maybe could just let me know on the chat box or even unmute your mic, because this is going to be the main context on what we are looking at this point in time, and what's going to guide us in terms of the action plan that we can have as a team, as individuals within the society to make a difference. So when we look at these social determinants health, the chart, we have the very critical thing at the center. We have age, sex, and hereditary factors. Those are things we don't have control over. So those will have to stay as they are. But the next cycle that we have, our individual lifestyle factors will have an influence on whether we are going to be mentally healthy or not. Social and community. Individual lifestyle, if you're someone who has been an outspoken person, an extroverted individual who likes interacting with other people, with the staying at home, you'll be affected. So how do you modify your individual lifestyle to enable you thrive in such a situation where things are not okay? Social and community networks. Probably every weekend, like for today, it's a Saturday, you would be out hanging out with friends, eating nyama somewhere and all that kind of stuff. If you're not able to do it, then we feel like we are kind of left down. We are not living the life we would have wished for. So we are not optimally functioning as we would want to be. So that's another problem that we're having. So how do we work around it? Agriculture and food production, I mentioned the contributing factors. So agriculture and food production, when we have access to food, you are satisfied, then chances of you being distressed because of lack of food is not there. Education, accessing education. When you're educated, you can think about solutions to your problems. You're more enlightened on the options that are there. And that one reminds me of one of the greatest advice that one of my mentors told me. The greatest the greatest motivators in life are two critical things: need for something, or having lacked something. Then after that aspect of lacking something, exposure will let you know about the possibilities, the ability to change your circumstances. So education becomes the exposure that you realize, and with this kind of platform, this kind of opportunity, these of ideas and knowledge that I've gained, I can be able to thrive in this condition, and I can address the problems that I'm having. The work environment is also a factor. Now we are working from home and all that. Living conditions, if you've been living with people who are kind of abusive to you, they're not as hospitable as you would want them to be, and now with the lockdown and everything, you are going to be zeroed down to be staying with them every other single moment. How do you ensure this doesn't affect you as a person to get mental distress at this point? It can move from distress to a mental illness. So how do we ensure we have these issues addressed? Unemployment, some people will be losing jobs. So when people are losing jobs, what makes you get a job? And how do you work around the unemployment that you might be facing? What options do you have? very critical. And these are things that need to be addressed. It might not be addressed on this particular forum where we are discussing these issues, but then as mental health champions, mental health advocates, what are we going to do to ensure employers will be looking out for the well-being of their own people? As a government, our government will be called on to do the right thing for the people. Access to water and sanitation, that is the social services that people need, healthcare services. At this time, mental health services have been compromised. People are not going to see their counselors. In terms of the response, the government did not even establish a hotline where, let's say, if you're having a problem, you can call on a toll-free number for someone to give you the psychotherapy counseling sessions that you might need. So how do we address those kind of issues that are there? So those are key things that we need to look at as well in terms of housing. Then there's the socioeconomic factors, the cultural factors, and the environmental conditions. That's the whole spectrum of everything that we've talked about. So once all these social determinants of health are optimized to be ideal, to be conducive for our own well-being as individuals, then we would be able to realize a healthy mental health condition, live in a society where we can realize our potential, we can be able to perform optimally in our jobs, contribute to our society, and be healthy entirely. And health, when you're talking about health, is not just the lack of a disease, but ability to be at optimum functioning condition in all the spheres of life. So those are the critical things that we need to look at how to address when talking about mental health. So with coronavirus, what are the pain points, the challenges that we are seeing at this point in time? One, when the initial outbreak started and the first case was reported in the country, there has been fear. There is anxiety and panic that is associated with knowing that there's a disease and it can't get to you and people are dying of it. So we already fear. And that fear makes you be unwell mentally because you're wondering, what if I'm the next person who's going to get it? How am I going to cope with all this situation? And if not only the fear of knowing that there's a disease, you look at the conditions under which the people who have been in isolation, some of them are going to cater for their own cost. It's stressing them out. Probably you're coming from a point where you're not even able to cater for your own basic needs, but now it's going to be summed up by you just getting a disease that you didn't have a choice to get or not to get, but it's all going to pile up on your own problems. So there's that kind of fear, anxiety, and panic that is there. Another kind of form of panic that has been there at the start, there was panic buying. Everybody's stocking up stuff because we're fearing when there's a lockdown, we'll need to use these services, these products and all. What happened to someone who doesn't have the money to buy them? Because there are some people who don't have the money to buy these products. So that is an issue. How do we address them? Because those are going to contribute to the mental health problems. So that calls on some kind of responsibility in terms of the information that we're sharing out to people, guiding people to be socially responsible. Then the psychological impact of infection of relatives and close associates. If it's someone who is close to you is getting infected, or someone close to you is going to be, one, they're either getting infected or they die in the course of the disease. For example, there's a case of this person who died in Sierra County and was given a rush burial at the middle of the night. The family were devastated. This is someone who just came home. And as Africans, we realize that when you have a relative who stays in the up country, when they come visit in the village, you feel like he's there to help you out. He's the person, the son of the village is back home. So this guy comes home, had an accident, then he dies in the process of being treated and is given a rush burial. The psychological impact of such kind of a loss is it's just too huge to be comprehended within that short time. And there's no extra care that's being given to the family. How do we ensure they're going to be able to cope with the situation? So those are some of the things that we need to look at. When they're in isolation, do they get the social support system they need? If, for example, I'm used to talking to my family every other day, then at this point, if I'm isolated in an isolation station, how do I keep in touch with them? How do I ensure that I will be in close communication with them? Because that is very critical. Then psychological impact on health workers. As I started, I mentioned I'm a health worker. I work as a pharmacist. So every day I have to go to the hospital. And in the evening, I have to go back home and ensure that I take care of my responsibilities as well. Imagine every moment when you get to the hospital, you know there is an isolation ward that's taking care of the COVID-19 patients. You are at a risk of being infected and you have to deal with it every other day. So that kind of psychological impact, do we get counseling sessions to know that anyway, at the end of the day, however bad it might be, you're going to be taken care of. You're being looked, you're looking, you're into, people are looking into your welfare. You get the support and you are treating the patients, you get the protective equipment and all that is needed for you. After that, do you have the debriefing sessions? Such kind of support system that I'm going to ensure that the health workers are taken care of. And taking care of them has a ripple effect in terms of the positivity that we receive. If the health workers are well taken care of, they're able to give quality services to the patients they're treating. Better treatment to the patients are going to get well and get back to their families, which is the key thing that we wish for. So, and them as individuals, they're also individuals in society with their relatives, with their families who look up to them. So they have to get access to the right quality of care. Then we have stigma and discrimination associated with COVID-19, and that is affecting anybody. If you, for example, the people coming from isolation wards and the quarantine stations, health workers, you're coming into a village and people suspect you already had COVID-19 coronavirus, or you're working in a location where you were exposed. It has an impact on you as a person, because these people might not be willing to visit you as much because this guy is a risk group of people. So that is affecting your social relations, and we mention social relations as a component of mental well-being. The economic downturn, job loss, and all that, people will be affected. People are affected. People will be affected, especially in a society where we depend on working day to day to get our daily bread. Then, at the end of the day, it's not going to be ideal for every other person. So we need to find a way to give redress to such kind of hardship that are coming up. Then the psychological impact of social distancing, isolation, that one I mentioned earlier. Then we have the long-term psychological impact of the outbreak, and it's going to affect every other person. And in that component, we're looking at it in terms of post-traumatic stress disorder. You've lost someone, or someone who is close to you has been infected with coronavirus. Then it gets to you to realize that this particular point in time, there was this kind of a devastating disease, and we dealt with it in a particular way. If you didn't get the support you needed dealing with the condition and post the particular case, then it will take a toll on you. How do we ensure these are addressed? So those are some of the critical things that we need to look into as well. And then even for the healthcare workers, like in terms of every individual in society, we have to look at the long-term impact of it. You lost your job because of coronavirus, the companies were laying off people. At that point now, moving forward, your kids can't go back to school. You can't take care of your family or even your extended family because you're Africans. We take care of extended families. So those are all the things that are going to pile up on you. How do we address them? So what can we do moving forward? As in mental health champions, we have very critical roles to play at this particular point in time. We realized that there were advances that were already made before coronavirus came into place, and there is work that have been done. It's a matter of scaling up on that kind of work that we've been doing. So when we're looking at the anxiety, the initial component, we have to be responsible in communicating our issues. In terms of reporting the disease, should we take pictures or videos of people who are facing hard times at a particular point? For example, there's a post that was shared yesterday of a lady in Kakamega who is in quarantine station with no bed, and the kid has to sleep on a carton box. It's devastating, and nobody would want to be in an isolation station. So if I'm already exposed, would I be willing to submit myself to the government? Most likely no. So that's going to affect the whole family. Then we look at it on the other aspect in terms of maintaining social networks and connections, the digital trends that are already there. Can you keep in touch with a friend, maybe through a text message, a video call, and all that? Those are critical things that we can look at as well. Can we look for ways of championing mental health services? I just mentioned, as a government response, there has been a hotline that has been dedicated to ensure we're giving response to people with mental health, people who are affected or infected with coronavirus. At this time, can we call on the government and other stakeholders who are working in the mental health care space, establish a designated hotline? I'm told Red Cross had a hotline 1192 that was offering mental psychotherapy support system. If active advocacy is done to ensure these services are available, and every other person, let's say the counselors who are there, we have say medical psychology students who kind of have a little knowledge in terms of managing mental health issues. We have the psychiatrists and the different practitioners who are in the system. They be engaged to offer these services to the public through the hotline remotely wherever they are. it would give us a way to support our people and to be able to respond in a better way. And those are the key kind of things that we need. Then factoring healthcare workers to mental health needs at this time. But generally, as a society, most of the healthcare workers, especially doctors, have been neglected in terms of looking at their own health and well-being. We see them as demigods who don't have problems as much, but at the end of the day, they are human, they're part of the society, and they are people like us. So when we're talking about the stresses that are coming with all these disease outbreaks, we need to look out for them and realize that these are also human beings within the society. They have related problems that they might be going through, and we have to ensure they have access to the care they need to be able to deliver to the society optimally. If they are a doctor, they need to ensure they give healthcare services. And their ability to deliver those healthcare services is dependent on their well-being. If they're stressed, they'll be stressed, and that stress will be transferred to the patient they're taking care of. And that is a loss to the whole society. Then another thing, we could commit to structural support for individuals and communities during and post COVID-19. There's kind of support that people are giving, people are doing donations and all that. That is amazing work, because at the end of the day, someone gets to access their food that they need. But after that kind of support at this time, can we put in place structures to ensure people can continue getting services that they need even beyond this time? And that can be in terms of creating kind of social networks where we can drive action for a particular cause, maybe do some kind of business within the local ground rule levels, social enterprises, as I mentioned. You're solving a problem while at the same time creating a job. And these are things that can amplify the effort that individuals are having in a country. And at the end of the day, we get a society that is self-reliant in a way, or if not self-reliant, they are sustainably able to cater for their basic needs, which is very critical at this point in time. You realize even when coronavirus outbreak started in the country, we were running out of essential supplies because we've been dependent on imports from other countries. And if you guys have been reading different news articles and all, they're talking about nationalism being the cornerstone after this phase of coronavirus. It means every other country will be focusing on their own local needs at their level. What happens to developing countries? What happens to our case, for example, in Kenya, where most of the things we've been importing, and for local production, they're too expensive or substandard to a point that we don't even want to buy them. Can we build a system that is socially responsible? We get the right quality of product, however much it is going to be expensive, but it's the right quality. And once we look at it in terms of having it at the quality, everybody will be interested in getting it from us. Then we now work on the economies of scale to ensure we produce in masses and ensure they are available to the public who need them. And ultimately, there is key component is on community engagement. If at all every action is being driven by the government as a government level without involving the community, then it won't achieve its goal. And that is what's going to lead us to realize whether we are making advances or going back on our promises and just doing it. It will just be rhetoric on mental health. We'll be talking about how we can improve mental health, but it's not going to deliver an impact. And those are the very critical things that we can do as a group of people and things that we can do at a personal level. And doing it doesn't start from waiting on someone to give you a platform. Most of us are on social media. We can engage our governments, we can engage our policy makers and all that to drive action on mental health. If we promise to ensure there's a task force that's going to look into mental health, what were the recommendations? If the recommendations are there, what are we doing at this point in time? Mental health problems are here, they will be here, and the best thing we can do is to ensure we get redress for them as soon as possible. So that is the scope of what we are looking at. And now the next part will be for us to have a discussion, anything that you guys think we need to talk about before we end the session, of which we have less than 7 minutes to go. So maybe you could